Fox 5 and Hot 97 present Street Soldiers with Lisa Evers.
I'm so glad you're joining us for this episode of Street Soldiers on maternal health disparities. I'm your host, Lisa Evers. You know, having a baby is an exciting time for most women, but implicit bias and sexist stereotyping can bring additional risks and higher mortality rates for women of color. The CDC says Black women are most at risk, regardless of their income level or education.
The CDC found that U.S. maternal mortality rates rose in 2020 to approximately 24 women per 100,000 live births. But for Black women, the rate is much higher, says Dr. Joynetta Bell-Kelly of Northwell Health.
Nationally, when one white woman dies from pregnancy-related death, there will be three Black women who will die. In New York State, the ratio is when one white woman dies, 5 Black women will die in New York State. And then in the city, 8 Black women to 1 white woman will die.
Though not as severe a disparity as Black women, Hispanic women also had higher risks.
A lot of women also feel that they are being told what to do, or they're not being heard, or they're not educated enough to sit here and say, hey, maybe that's not right.
The CDC's Health Equity Report found that multiple factors contribute to these disparities, including variations in quality health care, underlying chronic conditions, structural racism, and implicit bias. Doulas, basically advocates for expectant moms, can help women be informed about all their options, says Mama Glow founder Latham Thomas. She recently held an expo to raise awareness in New York.
It's like having a producer for your birth, right? Somebody who's thinking about all the things that'll matter to you, making sure you're educated, supported, and have the best care options available to you. But understanding also that a doula has limits. A doula is a non-clinical support.
BRIANNA GALVEZ gave birth to her daughter at 25 weeks during the pandemic shutdown and spent more than 3 months in the ICU. She says her premature baby had excellent care, but there were some doctors who made comments she found dismissive. She's part of a support group called NICU Mamas of Color.
Just things being said to me like, well, Black girls do better than other children, so you should have nothing to worry about. While my daughter was a pound and she couldn't breathe on her own, and I didn't care if she was Black, if she was white, if she was rainbow. I want the same level of attention that anybody else is going to get.
There are many reasons for this. Let's find out what our panel has to say. Joining me for this incredible conversation, which I'm so thrilled that we're doing right now, is Latham Thomas. She is the founder of Mama Glow. We're going to break that all down for you in a moment. Latham, thank you so much for being with us.
Thank you for having me.
Thank you, we appreciate it. Also with us is Dr. Joynetta Bell-Kelly. She's the Vice President of Strategic Community Partnerships for Northwell Health. Dr. Bell-Kelly, thank you so much for being with us.
Thank you for having me.
Thank you. Also with us is SASHA. She's a member of the Young Urban Moms group that was founded by Mary Almonte, who you've seen here on Street Soldiers many times. And she's also part of the podcast group where they're speaking out and really trying to raise awareness about a lot of these issues. She's also the mother of a 5-month-old, congratulations. And also,
thank you.
And also a 5-year-old. So she's got that firsthand experience. SASHA, thank you so much for being with us.
Thank you for having me.
We really appreciate it. Dr. Bell-Kelly, let me start with you on this. In terms of, we hear about maternal health disparities, we hear some very shocking levels of discrimination. What have you actually found out? What actually exists out there that, you know, you could say scientifically, this is what's going on?
Well, it's really interesting. You know, this is such a topic that's really important to everyone. You know, maternal health is an issue for everyone across the population. But, you know, as we know, it affects Black women disproportionately. So just to kind of level set, so each year in the United States, about 700 people actually die during pregnancy or within the year after. So then another 50,000 women each year experience very severe pregnancy complications, which can cause serious consequences for a woman's health later on. So every pregnancy-related death is so tragic because 2 in 3 of those deaths are preventable. And it's really important to recognize the warning signs and provide timely treatment and quality care, which can prevent that. So again, maternal death is an issue across the board, but it disproportionately impacts Black women. So the most recent data shows that nationally, when one white woman dies from pregnancy-related death, there will be actually 3 Black women who will die, and that's across the country. In New York State, it's worse. So when one white woman dies in New York State, 5 Black women will die. And then in New York City, believe it or not, in this city that we love, when one white woman dies in New York City from birth related issues, there will actually be 8 Black women who will die from pregnancy related deaths. And back in 2017, Black women gave birth to 23% of New York City babies, yet they accounted for 55% of maternal deaths.
Oh, that's so horrible.
It's terrible. And Black women, you know, continue to have the worst outcomes than others, regardless of their insurance or their socioeconomic status.
So it's not just a question of being in a low income community or a hospital that maybe is under-resourced. It's just across the board.
Absolutely. And we've heard the stories. We heard the Serena Williams story. We heard about Beyonce. We hear about, you know, this can affect anyone. It affected me. It can affect LGBTQ plus individuals. It can affect anyone. As a matter of fact, recent data also shows that Black educated women who are earning higher salaries are impacted more than uneducated white women or women of other races who earn significantly less than their counterparts. And it's everyone has an experience, and it's either direct or indirect.
Sasha, you just gave birth not too long ago. What was your experience like?
I would say my experience was somewhat, it was a little complicated because of my pregnancy. I had a little bit of complications arising. With my first, I didn't really experience any of those complications, but with my second, a lot of stuff started to come up with my health, with my son's health. And then when I gave birth, it was all trying to have a natural birth versus having a C-section. And then it was just, again, a little bit of a complication side, but somewhat smooth at the same time.
Do you feel like your wishes and your desires and your preferences were respected? Or did you feel like that you were looked at a certain kind of way?
I would say it was a little bit of both, just because, again, I'm on the younger side. So doctors tend to look at you a little like, oh, what is she doing? She doesn't really know. And then they don't really take into account what you do for a living or what you, you know, your salary wise. They just look at you and they see me, that I'm young, I'm Hispanic. They just think, oh, here's just another young girl. So doctors were more telling me what to do were asking me what I'm comfortable with on that end.
And that's part of that whole birth experience. Latham, you founded Mama Glow, and a lot of this is around just really changing the whole narrative about the motherhood experience, giving birth, and giving support to women. Tell us a little bit about what you do with Mama Glow.
Well, Mama Glow is a global maternal health and education platform. So primarily we're training doulas to serve alongside birthing individuals and families to navigate this experience. And so doulas are non-clinical care providers. So they offer emotional support, physical support, education, advocacy tools, and then partner support if there's a partner present to ensure that they can participate at their level of comfort in the process. And it's really helping people to, you know, have that extra, just like that extra hand-holding to navigate an experience that for many people, it's the first time. And for others, even if it's, you know, even if you have more than one child, everybody will say that each birth is different, each pregnancy is different. And also your needs are different. And so having someone who understands how to navigate that terrain and can help you with very specific information that supports you and your needs is critical. And when we think about this crisis that we're in, you know, for Black and brown birthing people to have access to doula support, to have providers who are from their own communities, who understand what they're facing and who can interface with their providers and their care team is critically important.
There's more to come, so stay with us. Latham, in terms of giving the support to the women, how critical is that?
I think that what we're seeing now in the United States, you know, there's a narrative that we understand now that this is the most dangerous place in the developed world to give birth. If you think about other countries that have, you know, an imperative to reduce maternal mortality, morbidity, The United States is well poised to do that, but when we've seen in instances of like COVID-19, our healthcare systems have been fraught and overextended. And also care providers are individuals, they're people, right? And so we need to ensure that the patient advocacy safety net centers birthing people, but also that the support people who are on the team, from the doctors to the nurses to the doulas, all work together, because we all have a similar outcome, which is like a safe and healthy birth. So they need that care to be continuous. They need that care to be respectful. They need that care to be dignified, but it has to be an imperative across the board. And it has to be a systemic shift that is made to ensure that people can get quality care like that.
Oh, absolutely. Dr. Bell Kelly, in terms of what we spoke before the show, you were telling me that you yourself have experienced, I don't know how we want to characterize them, but some people would just say straight up racist incidents, assumptions, false assumptions based on your skin color, regardless of your education, your knowledge, your desires, whatever. Tell us about that. Help us understand this.
It like I said, it happened to me too. During my birth, so I gave birth a lot later in life. I was 40 when I had my first, and 42 with my youngest. And it was a lot of bias and a lot of assumptions being made about my lifestyle. I was actually told by a physician that I should stop eating fried foods, when in fact I don't eat that much fried food. They just assumed that because I'm Black and because I had eclampsia, they wanted to give me my marching orders to, okay, go home and stop eating all those fried foods and you should get some exercise in, when I've been a marathon runner just about before I even had children. So just those little comments that were always made to try to direct me into a healthier lifestyle when they never even asked what it was that I did. And then the assumption that when I had eclampsia following my birth, I got readmitted into the hospital, and it was just assumed that I'd already had high blood pressure all my life. And I was told to just have her go ahead and start taking her medicine again. And, I never had been on medicine. So it was just those really blatant scenarios that made me see firsthand that, it really is something that existed and that exists
and
now.
And these false stereotypes based on race, basically.
Exactly.
Sasha, what about you? You talked about, yes, because you're a young Hispanic woman, that there were certain, here's another young woman coming in, giving birth. And then did you feel like, were there certain things that you did to try to have the baby the way you wanted to, or were there certain, tell us about that, because that was the second time around for you. Were there things you learned, or tell us about that?
So with my first child, I had a C-section. I was fairly young. My first child, I had him, I was 17. I'm 23 now, and I had my second, who's 5 months old. The first time around, I had a C-section because of my son really just didn't want to come out. So there was no really other alternative for him. We've tried all the medication, we did everything. And with my first, it was just like that. But with my second, I wanted to try a more natural approach to having him. And there was just a lot of back and forth between it. A lot of doctors. I had 3 doctors with my second, because again of my health complications. My son, he was a lot advanced. He was more advanced. He was showing that he was a lot bigger than what he was while I was carrying him. So there was a lot of
concern about that.
Concerns, yes. There was a lot of concerns about his aging and his weight and his height. So a few doctors were saying, yes, you could have a natural delivery. Whereas if another doctor was like, oh, you're young, you could just have another C-section and recover. But it wasn't really brought to the attention of C-section is a hard recovery, especially when you already have another child at home.
Another little kid you have to take care of.
Exactly. And then, I'm married, I have a house, it was a lot of things that weren't being brought up. It was just, oh, she's young, she could recover. She already had one. let's just do it again. They weren't really letting me decide on whether I wanted to have a natural delivery or if a C-section was just the route that I was going to go to.
Latham, what advice do you have for women who are hoping to become mothers, or who are pregnant right now, who are maybe, or maybe they're even dealing with, some recommendations that were given to them by their doctor, and they're like, wait, that's not exactly what I want to have happen. What advice do you have for them?
Yeah, so I think one really cool thing that we can all take away, and something that you can bring into every aspect of your life, we use this acronym called BRAIN, and it's a way for us to, and I'm going to break it down, but it's a way for us to sort of process information that comes in so that we can make decisions on consent, right? Whether we're going to consent to something or revoke consent. But for us to make an informed choice about something, we have to understand what's being presented to us. And so asking questions is really critical. And oftentimes inside of medical spaces, we're not receiving, like nobody's asking us before they begin a procedure or treatment. They're just kind of like going through the motions and maybe talking to us as it's happening, or maybe they explain it afterwards. But it's really important to get that consent before. And so one of the questions I ask patients and clients to think about first is, before anything happens, to ask, what is the medical indication for this, right? Is there a medical reason that we're doing this, right? That's the first question. If the answer is no, then guess what? Like, maybe we don't have to start this right now, or maybe we can move in a different direction, or maybe we can just like keep things as they are. And then I use the acronym BRAIN, which stands for, what are the benefits? What are the risks? What are the alternatives? What does my intuition tell me? And what if we did nothing, right? And so when anything comes, right, when you use that acronym and run the ideas through that, and then check in also to your gut. Like, what is your gut telling you about this? A lot of women will say, and you hear a lot of Black women and a lot of women of color will say something didn't feel right, and people will say to their loved ones who passed on, like they mentioned something, they didn't feel right, and then they're not here to tell their story. And so it's so critical to listen to that. And to act on what your gut is also telling you as information, because it's important information too.
Dr. Joynetta Bell-Kelly, what advice do you have? What advice do you have for women, especially as they navigate their desires within various healthcare systems?
Yes, exactly. One of the most important parts is looking at the antepartum, which is before you get pregnant. Make sure you're taking care of your body before you decide whether or not you want to get pregnant. Most doctors tell you start taking the folic acid, but do things like get your mental health screenings too, because, mental health is a real big issue when it comes to postpartum. You want to make sure you're preparing yourself, preparing your family, preparing getting your finances together, whatever you need to do to prepare yourself so that you can have the best outcome as possible. And to piggyback on something that Latham said, regarding providers, ask questions, ask 1,000 questions if you have to. Don't accept a physician or someone trying to hurry and scurry you out of the room or trying to get to the next patient. Ask as many questions as you need to ask, because it's your body that is going to be impacted by this condition. Again, pregnancy is a condition. It's not a status, it's a condition. And then the other part of it is finding your village. Look at your partner. If you don't have a partner, look at your family, look at your mom, your sister, look at community-based organizations. Fraternities and sororities are doing a lot of work with Black maternal health and helping to inform education. Also faith groups. Ask questions with women's health ministries around in certain faith organizations, but create a space where you can have a voice and you're educated so that you can make the best decision for yourself. And again, ask questions.
No, absolutely. Sasha, just final advice for other women?
I would definitely say, again, ask questions and let your concerns be known, or let your wants be known. It's definitely something that I've learned now, having my second child, if I were to have another baby, which is up for debate. But I would definitely let the doctors know how I'm feeling and what I let my birth plan be known, and definitely get the education and talk to other people, ask questions, and definitely just ask questions because that seems to be a big one, honestly. Just a lot of women would either
just listen to their doctors, really. And it's just like, you could listen to your doctor, but also don't be afraid to be heard.
Thanks for joining us for this episode of Street Soldiers on maternal health disparities. You can watch it again and share it on our Fox 5 NY YouTube page. Remember, use your mind. It's your best weapon. I hope it's your only weapon. I'm Lisa Evers. Let's push for peace, love, and justice for all.